Hello, everyone. My name is Kelly Crane. I'm a state policy specialist from Prevent Child Abuse America, and welcome everyone to our first discussion like this, first format with a state legislator and a Prevent Child Abuse America state chapter from Tennessee. We have with us Senator Beau Watson, state senator from Tennessee, and Kristen Davis, president and CEO of Nurture the Next, a Prevent Child Abuse Tennessee state chapter. And today we're just going to have a discussion around what legislative advocacy, legislative outreach looks like, and the importance of connecting with your legislators around issues that are important to your organization, that are important to yourself. And just really quick before we dig in, a quick introduction of Prevent Child Abuse America. We are the nation's oldest and largest organization committed to preventing child abuse and neglect before it happens. And we work around promoting policies and programs and resources that are informed by science that enable kids and families and communities to thrive. We have a nationwide network of state chapters. Kristen's one of those. And we also have nearly 600 Healthy Family America sites, which is our evidence-based home visiting program. And as an organization, we work at the federal level to lift up state policies that are good for children and families, and today just wanted to share around the relationship that is happening in Tennessee with their state legislature and the state Prevent Child Abuse chapter. So I will first just let you guys talk and introduce yourself, and I'll start with you, Kristen. If you want to just introduce yourself, your role, and a little bit about your relationship with Senator Watson, and then Kristen, feel free to kick it over to Senator Watson to introduce yourself, the committees that you chair in Tennessee, and kind of why you're involved in this work with children and families and the policies that are positive.
Well, thank you, Kelly, and thank you, Senator Watson, for joining us today. I'm so excited to be having this conversation with you. As Kelly said, I am Kristen Davis, and I'm the CEO of Nurture the Next. We are the Tennessee chapter of Prevent Child Abuse America. So I will say that one of the things that we have found as an integral part of our work is if we really want to impact families at the direct and community level, we know we also have to impact the systems that affect families. So we really focus on working with families in a 2-generational approach. And sometimes that turns into 3 and 4 generations at one time. But through our home-based services, through our crisis intervention programming, we are operating in a direct service space. And then several years ago, really realized that we have to advocate for families at a systems level as well. So that started to happen both in the community environment as well as the legislative environment. And we were really, really fortunate that Senator Watson was one of our first partners that we really were able to talk with. He was so gracious with us popping into his office whenever we wanted to, getting on the phone, really responsive. And it was so nice to be able to ask questions when we had those questions, because he's really the expert when it comes to health and wellness. And we felt like he was a really great partner for us from the very beginning, especially around those home-based programs. So we were really excited to form that partnership as we do both our direct service work and our systems change work across the state. So I'll pass it to Chairman Watson to introduce himself.
Well, Kristen, you're very kind for your nice words. I really appreciate that. I am Senator Beau Watson. I am sitting in the beautiful Chattanooga, Tennessee. I live in the Hickson community, which is just outside of Chattanooga. And for those who don't know much about Tennessee, I'm in the southeast corner of the state, bordered by Alabama and Georgia football fans, and then on the east by North Carolina. So I'm right in the cusp of the mid-state. I have been in the legislature since 2004, but was elected to the Senate in 2006. So now I am becoming one of the older members now, sadly, but true. My current role, and I've had a number of roles in my time in the legislature. Currently, I'm the chairman of the Senate Finance Ways and Means Committee, which is a really cool gig, Kristen, because as you know, anything that's really big that the state's going to do is going to come through finance, because we're going to have to find a way to pay for it. So I get the opportunity, along with my other colleagues, to work on some of the really big pieces of legislation, whether it's an initiative of the legislature or it's an initiative of the governor. The finance committee is almost always involved in that. And as you know, we all have a lot of great ideas. It's trying to figure out how to pay for all of them. Some famous finance chair coined a phrase of there will always be more good ideas than there are resources to pay for them. So it's also a challenging position to be in, because you do have to make tough decisions about good ideas when you don't have the resources to pay for them. So I do that. And then I am also on the Health and Welfare Committee, as well as the Commerce and Insurance Committee. The committees that I serve on, one is my experience in the legislature, but two, when I'm not playing the role of state senator, I work at Park Ridge Medical Center, which is a medical facility in Chattanooga, Tennessee, an HCA facility. I'm a trained physical therapist. That's what I spent most of my life doing. And so when I'm not playing the Senate role, I hang around the hospital and work with patients and work with my team here. I have a really great group of speech and language and occupational and speech therapists, as well as physical therapists. So I kind of get the best of both worlds. So my interest, obviously, in families and children is that, it's a key driver in healthcare. So if you're in the healthcare space, you're going to have been introduced to the challenges that exist in your community relative to children and families. And we have learned in more recent times the social determinants of health, and how all these different factors that maybe in the past we didn't think were that important are really critical to long-term outcomes for individual citizens and their communities that they live in. And we have learned that failure to address those social determinants can result in devastating consequences for families and devastating consequences for the communities where those families live. So that's a lot to say that, just my regular life in the Hamilton County area kind of leads you into this space where you want to try and solve some of the more complex problems that society faces.
Thank you. That was really well said. You have a good partner, Kristen, in Senator Watson.
Absolutely.
I just wanted to ask, Senator Watson, how, in just what you said, how important is it that your constituents or an organization like Prevent Child Abuse Tennessee, Nurture the Next, reaches out to you to educate you and kind of just engage with you around the needs of children and families in Tennessee, and even how should they engage with you? Email, phone, things like that.
Yeah, well, that's a great question. Each legislator is a little bit different, probably. So I'll tell you how Beau Watson best responds to people. Obviously, I'm a healthcare provider, and so we are very high-touch personality people. We like to see people. So the ideal situation is obviously a personal visit with a legislator. And I try to remind my constituents that those of us that serve in elected office are really the employees of the taxpayers. People get that backwards all the time. They'll say to me all the time, oh, I don't want to bother you, and I know you're busy. And I think one of y'all may have said that when we first started. Hey, thank you. I know you're busy. True. That's true. But I work for you, right? And so if my boss from the hospital here called me on Saturday and said he needed something, I would probably respond to because I work for him. So I think the public needs to be comfortable approaching. Obviously, need to be respectful of people's time and space and stuff, but the people in the public need to be comfortable approaching their legislator. And the most important way to do that is to meet them. Now, there are a lot of ways of doing that by email or virtual, or personal letters still carries a lot of weight, because if people take the time to write something down and pay 50 cents to put a stamp on it and mail it to me, then that has great value to me, and I will respond to that. So any of those ways, obviously the easiest intro now in the modern world is just to send an email to us. Now, each legislator has their own way of figuring out how they respond to emails in terms of, if you live in my district, then I'm going to respond pretty quickly. If you live in Idaho, I'll probably say, move to Tennessee, and I'll kind of talk with you about it because you don't really have anything to do with what we do in Tennessee. So I think, email really makes it easy to access us. But again, in terms of value add, personal letter, personal phone call, and then actually a visit. Now, from an advocacy perspective, like an organization that's advocating or their members are advocating, then obviously it's critical that you make sure that the people that are representing your organization are from our respective districts. Legislators, and Kristen knows this, legislators respond to critical mass where they live. There is a rule in the legislature that a member will always vote their district first. And when you think about it, that makes sense because we are elected to represent the people of our district. Now, we have to take into account the state as a whole, but at the end of the day, our vote is the voice of the people that we represent in our district. So if you're an advocacy organization and you're going to reach out to a legislator, then it needs to be somebody from that area that legislator represents, because that person will be representative of the people that representative represents. When I first got elected, and I think every legislator has this experience, I went into the legislature and I looked around, I listened to people talk, what they had to say and all that kind of stuff. And I thought, how in the world did that guy or that lady get elected, right? And then over time, I went and I visited their districts. I've had the opportunity to do that. And you go, you know what? I get it. Most of the people, almost all of the people that are in elected office, if you go visit their district, they are their district. Now, you may not like their position. You may disagree with their position on issues. But if you go to their district and visit it, you go, you know what? It kind of makes sense that Beau represents the 11th Senate District. I can kind of see him reflected in the people that he represents. So because of that, it is critical that you have someone from that legislator's area or as close as you can be to that area to speak for you with that legislator. And then from a national perspective, a national organization, it doesn't do a lot of good to come in and be from Wyoming and tell me that you're representing the interests of Tennesseans, right? You're going to need someone like Kristen, who is a Tennessean that represents the interests of Tennessee. And that's just how state governments operate. So, those are easy ways of accessing members and getting credibility with the members around the issues that are important to you. And remembering that we are approached about a lot of issues, and members select the issues of which they want to become a quasi-expert in. And then they listen to the advice and counsel of their fellow members who have chosen to be quasi-experts in other areas. So, for example, some things that are in the judiciary, that's not in my wheelhouse. And so when something comes up that I don't really understand in the judiciary, I'll either reach out to members on the judiciary committee or I'll reach out to judiciary people in my district to get advice and counsel on where what I need to think about a piece of policy.
That's all really helpful context and just a really good way to lay the groundwork for how state legislatures work too, and the role that constituents play. Kristen, as a state organization, how did you start to engage with Senator Watson? How did you kind of open that door as a state and the relevance of his community? And then kind of how did you lift up the needs of Tennessee children and families to the senator and the legislature as a whole?
Yeah, so I think one of the things that we, as Senator Watson has mentioned, one of the things that we felt was an important piece was we do have constituents that live in Senator Watson's district, and the programs that we operate are there as well. And given his position as chair of the Finance, Ways and Means, we also knew that that was going to be a really important relationship for us to keep and maintain. So when we really first started to kind of dip our toe into legislative advocacy waters, we really just started by sort of emailing all of those legislators who were serving the districts that we also served, that were on key committees that we knew were important for the issues that were important to us, and just started reaching out to them and saying, would you be willing to take a meeting with us? Could we have 15 minutes of your time? And got a really great response, and really just started going in, sitting with each of those members, asking questions about what do you think we could be doing to better serve your district, but also here are the things that we are doing to serve your district. We often took families that are in our programs with us to talk about the issues and the challenges that they were facing living in those communities, and the things that they had experienced that were successes in our own programs. So one of the first interactions that we had specifically with Senator Watson was around our home visiting programs, and talking about the importance of home visiting, as especially it relates to long-term health outcomes and key indicators for health, as well as making sure that families could maintain economic success well into the future, and have that next generation of children that were starting off stronger because we were able to prevent early childhood trauma with those programs. So I remember I was in Senator Watson's office and I said, would you like to go on a home visit? And he said, absolutely, I would love to go on a home visit. And it's one of those moments where I thought, I never expected that would be something that would be of interest. And he did. He came to our Chattanooga office, met our staff, talked with our home visitors, went on a home visit with one of our home visitors, met a family on a home visit, had the opportunity to engage with a family and their baby in their home. So that was really an exciting opportunity for us to showcase the work that we were doing in Senator Watson's community. So beyond that, it really just became sort of a natural relationship, because we both had interest in families with young children. And Senator Watson has been such a strong supporter of evidence-based home visiting in Tennessee. So we were really able to call him up when we had questions about the budget, when we were trying to make sure that the state budget did include home visiting, that, you know, there were times when I would be in his office or call him and say, can you explain this piece of the budget to me, because I don't deal in this every day. And he did. So he was able to explain it to me. And so it really just became a lot of opportunity to talk about things that we knew collectively were impacting families and kids, and have that common interest that we knew would make a big difference, not just in the district where Senator Watson is, but across the state. And so being a part of the Finance, Ways and Means Committee was really helpful for us as we were advocating for home visiting to be included in the state budget. But beyond that, working with the Department of Health to make sure that the programs were quality, that they were being implemented properly. And that's an ongoing conversation that we have regularly with legislators across the state. And then, as you know, and has been highlighted nationally, the Temporary Assistance for Needy Families Reserve that was discovered in our state, and had the great opportunity to work with Senator Watson around how that TANF money was going to be used to support evidence-based home visiting. And beyond that, he sponsored some really incredible legislation this year that we were able to come out in public support of, because we knew that we had worked together constructively on how to best use those funds for families who are living in poverty, and to help lift them up out of poverty. So that's been a great opportunity to really have ongoing common interests that that are great service to families. So it was nice to be able to, have him see our work, showcase our work, have the opportunity to tell him about that and have Senator Watson ask questions about that, but also for us to go to him and say, tell us more about this. We don't understand this part of the budget, or tell us the likelihood that this is something that could be successful in our state monetarily. How can we be put ourselves in the best position to be able to be successful with the work that we're doing?
Yeah. So Kelly, one of the things it's the Greeks wrote about this a long time ago, that if you are going to rule the mind, you must first own the heart. And one way of doing that is, people have to feel something at a personal level. And, being able to touch something, feel something, see something, that just makes a difference in one's perspective on any kind of program. We are bombarded daily with program ideas, and most of those don't get the result. They get results, but they don't necessarily get the results that we expected or wanted. But to help a legislator appreciate a program or an idea or a concept, you have to make it personal to them, and that's just human nature. I mean, we're all that way. I'm not very good at shopping online, because if I can't see the product and feel the product, I don't have as much trust in it. I'm getting better, but I'm not trusting it. The public's no different with when we're asking them to allow us to spend their money on a program or something. They want to be sure that we've, in Southern words, kicked the tires and checked it out and made sure that it's worthy of their investment. And we should think that way. And one of the things, the reason that I'm a big fan of home visitation is that it has a lot of evidence to support its effectiveness. It's not 100%, nothing is. But compared to other things that make us just feel good, we know that home visitation programs actually have an evidence-based result. Now, that terminology has gotten worn out, and we'll shift to some other term, but at the end of the day, an appropriator like myself has to be able to look back at the public and say, look, we invested a lot of your money in this concept, and we have proof that it works most of the time. And for those kinds of things, the public is willing to invest in that. What the public doesn't enjoy investing in is something that we do, it makes us feel good, but it doesn't really get the results that we promised it was going to get. And then we keep doing it year over year over year, knowing that it's not getting us the results. So one of the key drivers of the temporary assistance for needy family legislation that we passed this year is that the new programs that will be developed out of that have to meet the rigor of academic study to prove randomized controlled trials to prove that they're actually doing what we say they're going to be doing.
Thank you for sharing all that, and thank you for taking Kristen up on her offer to come for the visit. Because I was going to ask.
Listen, it was great. I mean, again, to see one of her team working in the field. I mean, again, as a healthcare provider, we have a rule: see one, do one, teach one, right? So, seeing someone do what you've asked them to do helps solidify your thinking on whether you're doing the right thing or not. And, those kind of programs are obviously making a difference. And so we want to try and invest more in that kind of programming.
I have one last question for you guys. It was from Jasmine, submitted a question through our social media on Facebook, asking, what's the best way to learn about a representative's or senator's legislative priorities or their issues of interest? And then what's the best way to kind of get on their radar and get to know them?
Well, Jasmine, that's a great question. The first thing I would say is that when anyone runs for elected office, they attempt to communicate their core values by the issues that they choose to highlight during their campaign. So that would be one way. Some of those things are very generic, like, child safety, right? That's fairly generic. Not many people against that. I don't know of many people who are against child safety. But that's the first step, is kind of what you see in a candidate's campaign and what they are talking about and what they are, particularly new candidates, what they're proposing to change about the system, right? What's their real interest? The second level is their professional life or what they have done throughout their life. If they've been a school teacher, you can probably be pretty sure that education is probably high on their list of interests. If they're a healthcare provider, you can be pretty sure that healthcare or health is pretty high on their interest. So knowing what a person, and again, usually in the campaign, that will come out because, elected folks like myself want you to know who we are and what have been the formative things in our life that have created us as candidates. So you'll hear a lot about that as well. And then once they're in the legislature, their committee assignment really starts to narrow their field of view because the committees have so many things coming at them that you can't, you get focused. Like if you're in the Commerce and Insurance Committee, you start getting focused on things related to commerce, business, insurance, and other things that are of equal importance, but you just don't have the time to take up. You let other committee people work on those. But now every legislator has their sort of side job, which is representing what's important in their community. So between our adjournment in May and where we sit today, I've had probably 30 people who have some kind of legislative idea for me around a myriad of issues. So the final level is, what's going on and what's being talked about in your community, because those members are going to be engaged in that. And if it's important to their community, it's important to them. So those would be kind of the four levels that I would say you would evaluate. And although it's really hard, members can change. The problem with the modern political world is that you're recording this, and whatever I've said here is going to be maintained in perpetuity. And the problem with that is that if we had been having a policy discussion and I had taken some political position today, 10 years from now, you're still holding me to that political position, even though maybe I have learned a whole lot more than I knew when I made that statement. And in the modern political world, unfortunately, we hold people accountable for any comment or statement on a policy that they may have made even years ago. And we don't give elected leaders the opportunity to develop and evolve their thinking. So some are just apprehensive and don't say anything at all. And others get locked in and box themselves into a corner by what they've said. I wanted to come back to something that Kristen was talking about just for a minute. And I know we're probably running short on time and I can be long-winded, Kelly, and I apologize to you and to your viewers. But one of the most important things that you can do in developing a relationship with a legislator is be able to talk to them when you don't agree with them on an issue. It is very easy to go in and talk to the people that agree with you. It's a much more difficult circumstance to talk to people when you don't agree. But I have found in my years at the legislature that even the people that I disagree with vehemently, there are things that we agree on. Like we would all agree that protecting children is important. Now, you might have a different way of getting there than another legislator might have, but we agree on that protecting children is important. And that is the hook that brings us together. And you just have to be willing to work with people, even if on the policy side, you are in a different place than they are. And that is the quagmire that the modern political system finds itself stuck in, particularly at the federal level. At the state level, just because the way state government works, and because at the end of the day, even though people don't realize it, state government does most of the heavy lifting, and we don't have the option of not doing anything. So you have to kind of be able to work with the people who, even if politically you disagree with them, you both agree that children need to be protected, and find that common ground that you can work with them on. And, that's just so missing in the modern political world, but still so necessary. And maybe it's always been missing, but people just dig their heels in and, they say, well, I'm not going to go visit Senator Watson because we just don't agree with each other. And that just doesn't advance either of our cases or our causes. And if you're going to send us an email, and Kristen would probably advise her constituency of this as well, it's best to start off, at least to the degree that you can be kind, by being kind. Starting off with calling me a bunch of names, which people like to do, and I get it. And sometimes I want to call them names. And then in the next paragraph, asking me for something, that kind of flies in the face of human emotion and human behavior. So I go back to what Tip O'Neill said, politics is the study of human behavior, and understanding how people tick is just as important, if not more important, than knowing the technicalities of a specific piece of legislation.
True. And I'll just say, I agree, Senator Watson. We've been in lots of member offices where we didn't necessarily agree on strategy, but there's always common ground. And we are a nonpartisan organization, and we feel like child abuse prevention at its core is a nonpartisan issue. And but it's finding that common space and making sure that we can still have those conversations, because we know that every relationship is important. And I have similarly had someone say to me, there's no such thing as permanent friends or permanent enemies when it comes to politics. So just remember, who you count as your enemy today might be your friend tomorrow, and to remember that. And I do think that, Kelly, one of the last things I'll say is that we have had such incredible luck with building relationships with legislators outside of session, because we can see them in their town, we can see them where they live, we can actually sometimes see them in their day job, if you will, and they have more time to spend with us at that point. And that is when we can really start to say to a member, tell me how you got here, tell me what really draws you in, what makes you tick, what are you most interested in, and what do you think that you'll be really looking at hard in the next session. And so we can start to have those conversations in a much more relaxed way than in session, when they are so frantic, just trying to get to committees and make sure that they're meeting with probably what equals hundreds of people a week. It's nice to be able to see them where we serve families in our own hometowns and in their hometowns as well, to be able to have those more relaxed times to have longer conversation.
If you don't hear anything at all from this conversation, that is what you should have heard, because that is just true. I mean, that's the best explanation I've heard. Seeing somebody where they are, it's like what you do every day, right? You can only help your clients when you help them where they are. Right.
That's right.
And legislators are the same way. And being out of session, I just think that is the best advice that's probably been given. So you can kind of take everything I've said and take it away and turn this into like a 2-minute session. So well put.
Thank you. Thank you. And thank you for always seeing us outside of session too.
Right. Yeah, you're busy people. So thank you so much for taking this time to share and for all that you are clearly doing for children and families in Tennessee. So thank you, and for enlightening us on how this relationship it seems to be incredible and beneficial for children and families in Tennessee. So
absolutely,
I really appreciate the conversation, and thank you for letting us record it. Senator Watson will lift up it's only been good things. So thank you so much.